So I'm Dr. Scott Morris of Church Health, here today with the President and CEO of the United Way of the Mid-South, an organization that has served our region for nearly 100 years. As President, he has focused the mission to make addressing Mid-South poverty its top priority. Thank you for joining us for a conversation with Dr. Kenneth Robinson. So Dr. Robinson, Ken.
Hey, how you doing, Scott?
I'm great. You and I have known each other since you moved to Memphis in 1991.
You're absolutely right.
So you came here as a Harvard-trained physician,
Yeah.
an AME pastor.
Yeah.
To be the pastor of St. Andrew's AME Church,
That's
you
right.
took it from a relatively small congregation to what it is now, one of the leading congregations in Memphis. So how in the world did you go from that, which along the way you became the Commissioner of Health for the state of Tennessee, to now be the President of the United Way?
Well, really, it doesn't seem that way, Scott, but you really know it is logical and rational because I was always biprofessional. When I was practicing medicine, and even when I spent a little time as an assistant dean at the College of Medicine at UT, I always was simultaneously as a professional pastoring churches. I pastored for 33 years, and my passion was bringing resources from government, from public health, which I certainly did as commissioner, from academic medicine, and really bringing resources from the philanthropic community to support the structure of the work at the St. Andrew Enterprise. For 25 years, we were there in South Memphis, dealing with families, many of whom were living below the federal poverty level, but building affordable housing, after school programs for the young people, high quality child care. We started an early charter school, the first elementary charter school there. And the point for me was creating a healthy, sustainable community with multiple resources, a small grocery store. And so in 2015, I ended up in this job.
So in many ways, from my observation, you sort of ran a little mini United Way at St. Andrew.
Well, we were able to bring in, with the help of a lot of partners, local foundations here, government grants, about $23 million of resources there in what had been a pretty distressed community to a church that really had sort of lost its relevance to that community. And so I practiced that. I practiced what I'd preached, whether I was practicing medicine or governmental public health or pastoring a church. And I had 25 years of volunteer experience with United Way, and the board thought, after a national search, to just look over in South Memphis and offer the job to me.
So as a physician, you know, most people think of doctors as treating hypertension and diabetes, but you always had a much bigger vision of that. So
Yeah.
Can you just talk about how the doctor piece of this led you to think about public health and even as the Commissioner of Health, how you viewed this in a much bigger way than most people think about it?
Well, you and I are really birds of a feather because we didn't do the traditional thing in medicine. And when I trained after having accepted my calling to preach, my first year in medical school, I realized that for me, I was going to be concerned about the whole person and the whole family and the social environment in which the patients I was seeing lived. And so that has driven me. I grew up in an African-American urban community in Nashville. As Commissioner of Health, I was concerned about under-resourced communities and families. I was concerned about the chronic diseases, the obesity, the hypertension, the cardiovascular disease that really characterized populations in rural Tennessee and urban Tennessee, just alike. As a policy advisor here to the Shelby County mayors, I was trying desperately to help pull together extraordinary health care resources, but still in a county that had very poor health outcomes. And this all required collaboration, networking, and I've been called, and passionately I've been following, as you have in another way, how to bring those resources to bear to improve the health, the holistic health of individuals.
So in many ways, in our world, we refer to this as the social determinants of health.
Absolutely.
And maybe you could just speak something as to what that even is.
Well, really, those are the conditions in which people are born, they live, they work, they play, they often die. There are things that are not related to health care. You and I both know that health care really accounts for a very small percentage of health
10%.
outcomes.
Only 10% of
That's
anybody's
right.
health outcomes.
And it's everything else. It's education, employment, the poverty in which people live, and those social determinants, the isms that people face, the classism, sexism, racism, those are the kinds of things that really push or propel people in ways that we don't want them to live and into unhealthy lifestyles. And that's always been a passion of both of ours. I think that's why we're such good friends.
Well, that's true how we're good friends, but I mean, you now at United Way are biting off a really big issue. I mean,
Yeah.
poverty is not just like a little thing that you go solve.
Right.
So talk to us about how you're viewing the United Way's role in addressing poverty in Memphis, which, you know, you and I, in some ways, we both came to Memphis because we realized what the need was.
It drove you here, and unfortunately today, 28 years after I first came, the poverty statistics are still bad. 1 in every 4 Memphians lives in poverty. We have the second highest child poverty rate in the nation, 4 out of every 10 children here. And I just decided that for a guy who believes in systems and who believes in coordinating resources and bringing all sectors to bear, the United Way has always worked at that intersection of the nonprofit community, corporate community, faith-based community, philanthropic community. And instead of just being what we always were, which was an opportunity to do some collective grant making and collective fundraising, I thought that in our sweet spot, in the agencies and the organizations that have been serving individuals and improving their quality of lives, but doing them as individual agencies in silos, that we could do what you and I have always talked about. We could work more holistically, we could work more collaboratively, and we could help those multiple agencies that United Way has been funding, that the community trusted us to fund and to ensure that they're performing high quality services, that we could pull them together, connect the dots, that we could teach our nonprofit social service agencies to work together, to have some shared purposes, and really to help propel persons who are living in poverty. 73% of the people that walk through the door of a United Way program or service, 73% of them are living in poverty. We could do better than just fixing one issue at a time, one program at a time. Wouldn't it be wonderful if we worked in a United Way? And that's what we're doing.
You know, unless you're on the front line,
Yeah.
I think a lot of people don't know what United Way has been doing over the last couple of years to really try to make a plan for how we in Memphis could address these issues. So could you just talk a little bit more about how your process and really what your conclusions have been at this point?
We've been marvelously blessed for over 95 years. Because of the generosity of individual donors, we've returned $800 million to high-performing agencies in the community. But the difference between what we're doing now is that we are aligning our grant making rather than a more scattershot approach at funding agencies that are all doing great work. We now are aligning our grant making so that agencies that can talk about how they are helpful in advancing people from where they are to where they dream to be are those that get grants from the United Way in a significant way. And on top of that, then we are aligning the work of those agencies to say, if you do something in education, if you're working on employment, if you're working on food insecurity, if you're helping someone overcome drug or alcohol addiction, if you're helping a veteran find his way and her way back to society, we can do this by connecting the dots, because people in poverty have lots of issues. They have problems with food security, with housing, with employment, with education. And so by creating Driving the Dream, by creating the intentionality that United Way is pushing, promoting, facilitating, creating the capacity for agencies to think alike, for agencies to work together, to make coordinated referrals, to use data for the first time. It is a major shift in how United Way works.
So driving the dream is the umbrella.
That's right.
That's the moniker you use for the program we're talking about here. So
that's right. And you know, what we're really saying is that people who are struggling are no different from you or me. They all have dreams for themselves, for their children, for their families, and yet an intentional approach to keeping individuals from having to start here, tomorrow go to another agency, start all over again next year at a third agency, to have no communication between those. That an intentional approach, driving the capacity of an individual or family to map his or her path towards his or her dream. A path towards self-sufficiency is what we're doing. And to do that, we've trained our agencies to deal with individuals who walk through their doors differently. Rather than thinking of just transactional approaches, we can do that. They've been doing that. Now the question is not only what do you need today, but what other kinds of services that might be in a Driving the Dream network of agencies, that might be among the United Way partner agencies. What other kinds of services might help you move from where you are to where you dream to be? And we're creating the connective tissue, the oversight, the feedback. We're providing the capacity for agencies to improve the quality of their services based on whether individuals are really getting better, if they're really advancing towards self-sufficiency.
So to play the devil's advocate just a little bit. So
now that's a bad role for two preachers.
You're right about that. But what do you say to somebody who says, this is just too big? You know, trying to attack poverty in Memphis, that's just too big for any entity to try. So what's your response?
I think they're right. And the beauty again about United Way is that we're not one entity. We really sit at the synthesis of all of those different sectors. And we're pulling resources from the corporate community, from governmental sectors, from the other philanthropic entities in Memphis and the Mid-South. And more importantly, we're not trying to boil the ocean and reduce poverty. We are, however, trying to do what we've always done well. We're trying to provide services to individuals who have walked into programs and agencies funded by United Way, but on an individual basis, document that those persons, often women with children, that those persons, that those families are advancing. And so really for us, it's in our sweet spot. We've always worked by funding individual agencies.
So
we're just doing it better.
I think most people don't really understand how United Way works.
Yeah.
So can we just go back to square one?
Yeah.
I mean, how many agencies are
right.
there?
So,
what happens if I give $1 to United Way? Where does that dollar go?
Right. So we are a public charitable foundation. At our core, we're a foundation. 95 years ago, there were 20 agencies, and a group of people came together and raised $400,000 for those 20 agencies. So the core approach to our foundation is that individuals, many of whom are employees at about 400 companies in the Mid-South, commit to share a portion of their paycheck by payroll deduction to United Way. Sometimes they designate what agencies they'd like to support. The vast majority of their donations come to United Way in a community impact fund. And we have about 100 volunteers every year that go out into the field. Agencies apply for our grants, and those volunteers ensure that there's good administrative capabilities, that there's fiscal and fiduciary responsibility, and more importantly, that the agencies will do what they say they will do.
So if an agency is getting United Way funding,
that's right.
United Way is there as the donors' watchdog. I don't know if that's the right word.
We're the
but,
good housekeeping stamp of approval.
Right.
And the donors for 95 years have trusted the United Way to only fund programs and services that are efficient and effective. And we look at that outcome data every year. The difference now is that as opposed to just being a pool of resources, and many donors today want to think about what is the larger gain, what's the greater good for the greatest number of people. We don't just want to fund programs. People can do that on their cell phones. But is there a way to make Memphis and the Mid-South better? So now, through the Community Impact Fund, donations come in. We are also funding, with support, by the way, from other foundations and public funding, we're supporting the transformation of lives. And so people say, oh, that makes a lot of sense. If 3/4 of the folks walking in are already struggling, they have challenges. In fact, they have multiple challenges that one agency can't meet and face. It makes a lot of sense for the United Way to be encouraging, teaching, training, incentivizing those same agencies that we've been funding to work in a united way. We fund about 70 agencies, and we're giving out millions of dollars.
So 70 agencies. There are what, 2,000 not-for-profits
probably
in Memphis.
more than 5,000 now.
Right. So how do you get to be a United Way agency?
So many of these agencies have been United Way agencies for years because they are the best, and their leadership are among the brightest in the nonprofit community. And you would know the names of many of our agencies: Boys and Girls Clubs, American Red Cross, the Memphis Oral School for the Deaf, Salvation Army. There are 70 agencies, however, many of whose names you will not know. But United Way and our volunteer board, many of whom are corporate executives, United Way and our volunteers who work throughout the community to assess that programs are really producing what they said they will do, they have determined that there is a core of agencies that really are highly effective and highly efficient. They've always done a good job. The key now is driving the capacity for them to work in a unified, collaborative, connected sort of way for the benefit of the individuals and the families who walk in.
So in order to get United Way funding now, is that part of the deal? Is I've got to be willing to be collaborative?
Yeah, well, we're actually asking what many, many foundations have asked for many years, that you certainly collaborate with other agencies. But we also want programs that we fund to articulate in what way they are critical in advancing people from poverty to prosperity, or from crisis to self-sufficiency. We want that to be the United Way story. We don't just want to take funds in from our 25 to 30,000 individual donors and just pass it out. We need to have a cause, and our cause in the Mid-South is that there are these huge chunks of our neighbors. When we have the highest poverty rate of any metropolitan statistical area with a population over 1 million. In the nation, the highest poverty rate. When we have that level of child poverty, we as a United Way say that we can do better than simply passing the funds out. Yes. We can work in a United Way.
So again, I think a lot of people haven't paid that much attention to this and might think of United Way as a government agency. But so you've made it clear you are a private, exactly,
charitable foundation.
Right.
And we do have a great cohort of individuals out in the community. Either they were working at one point and heard about United Way, or they have just picked up, particularly now on this message of driving the dream, helping people advance, move. Preachers talk about running around the same mountain for 40 years. There are people in poverty that have been going around the same mountain, needing the same services, having the same issues, having the same challenges. So when people in the community hear that United Way today is all about intentionally, functionally helping to connect those dots and advance people, it's really what you're doing. People walk into the door of Church Health, and they may come with one problem. They may have a fracture, they have a toothache, but you look at them holistically and you've discovered that there is a network of other providers and physicians, and you've developed that over the years to say, I'll fix the thing that you have broken today. But if I also know that you have other issues, I'm not going to let you out the door without hooking you up with some other resources.
So back to how people donate. I do not have to just give my money to United Way. Of your 70 agencies, if I want it all to go to one of them, I can designate my gift, right?
You could do that. And in the past, I think that United Way pretty much specialized in doing that, because persons knew they had one agency and that agency is the name they know. really for me, as a systems thinker and a person that's interested in more systemically improving the lives of Mid-Southerners, I also know that there are many agencies, again, that are not familiar to donors. And we are grateful that our donors have trusted us for 95
So
years.
the trust is the most important
Trust
thing,
is
right?
huge. Trust is huge. My credibility as a leader, your credibility as a leader at Church Health, trust is huge. If you can believe that we are only supporting and funding agencies, giving grants, now, by the way, to agencies that are just in the mix, that have particular roles. We have now a memoranda of understanding with agencies that are not typically United Way agencies, but who also interface with individuals who are struggling, that are in poverty. Trust is a major factor. I'm building that every day. We want people to see the fact that 94% now of the individuals whose lives have been impacted by this system of care called Driving the Dream, 94% of them acknowledge themselves that they are advancing in at least one or more of those quality of life domains. Their housing is better, their health is better, they're getting employment training, their children are in high quality child care. That's real data, but to get that sort of data, we can't work one agency at a time. This is the vision and the mission of Driving the Dream.
Hopefully we've made it clear you're not a government agency.
We are not a government agency.
But how do you interface with city or county or even state programs that are trying to address similar problems, we hope?
Well, one of the interesting things is that we have been able to advance a model that even government agencies think is more effective and efficient and is much more likely to improve the lives of individuals than what they've been doing by funding individual agencies. So we will accept referrals of their clients or customers. We are receiving funding from the Department of Human Services that know we can do this well. And we are just able to say, if you're going to fund us, if you'll give us the resources, we will do the work and advance individuals from where they are to where they dream, not what the government wants for them, but where they want to go.
So speaking of dreaming,
yeah.
I mean, I don't think you're ready to retire.
No, not at all.
So what is your plan for the near future here as the leader of United Way?
I really want to take this model. It's a prototypical model of United Way. It can be replicated in places all over the nation where there's a high poverty rate and complexity in the lives of individuals. Let's replicate it. Let's first demonstrate that people in the Mid-South are living more hopeful and resilient and self-sufficient lives. Let's pray and hope and work that the sector of human service agencies comes together in ways that have never happened before. Let's hope that what we will have is the opportunity for Dr. King, his dream to come true, that not only will we know that there is poverty, but that we will mobilize and align resources to now address poverty, at least one life at a time, one family at a time. In the Mid-South. It's possible.
So the dream we're talking about here is Dr. King's dream, right?
It is Dr. King's dream. And it's the dream of the families and the individuals that you serve and the individuals who've been walking through our doors. And it's my dream that when we meet again, Scott, we won't be having the same conversation about the high poverty rates in Memphis and the high child poverty rate, which absolutely relegates those children to live lives in poverty and not have the same sort of outcome that we dream for our children and our families. I hope, my dream is that one day we will have a community, we will be leading the nation and showing how it can happen. Church Health leads the nation in showing how to holistically heal individuals and families. We want to lead the nation in a clear, demonstrated, coordinated, facilitated approach to advancing people from poverty to prosperity, one family, one individual at a time.
Yeah, so I can assure you that Church Health is fully engaged with Driving the Dream. I personally give my gifts to Church Health through United Way.
Thank you very
just as a
much,
way
Scott.
for us to be linked together. And I hope other people will do the same thing.
And I want people to see that. I want them to know that you trust us as others have been trusting us. And if people don't know United Way, I trust that this program, this conversation will help drive them to help us drive the dream.
But again, I mean, even though Church Health is not a United Way agency.
That's right.
I mean, that's an example of how all these entities have to be intimately linked together.
We're seeing the same people. We're seeing folks that are working, that are uninsured, that are poor. We are serving them in all of our agencies and programs. What a great idea.
But nothing
if we
more
can
important
link
than
together.
cooperation.
Nothing more important than collaboration, cooperation, connecting.
So I just want to end with asking about your partner in all this, which is Marilyn.
Yes.
So I know that she is fully engaged in this work as well.
Absolutely. She's been a United Way volunteer at a leadership level, as I was as well, for many, many years. She is leading our Women's United work among the leading ladies, helping women to understand they can advocate much of the time for women who are leading children and families through poverty. And so Marilyn has been an extraordinary partner, not only as a corporate leader and executive here and my co-partner as pastor, but now in helping us with this driving the dream at United Way.
Yeah. Well, Ken, there's so much more we could be talking about on this topic. United Way is a powerful entity in Memphis. The Driving the Dream program could not be more important for us to find a way to link arms and move together. And
absolutely.
Having you as the leader, it makes me feel good about the leadership, and I hope everybody does as well. So
thank you so much, Scott.
Absolutely. I'm Dr. Scott Morris, and this has been a conversation with Dr. Kenneth Robinson.